Survival is everything when it comes to systematic lupus erythematosus, SLE, or commonly known as lupus, which is an autoimmune disease that affects thousands of people every day. Although a vast number of people are diagnosed with the disease each year, the general population knows little to nothing about the disease itself. The latter proves to be problematic for many lupus patients when trying to explain the conditions. Therefore, I am providing you a brief overview of the disease, including what it is, who it affects, and how the disease itself is treated. Now let me inform you on what lupus is. According to author Daniel Wallace in the title Lupus, the Essential Clinician Guide, published in 2014 by Oxford University, lupus is a multi-system pleomorphic disease in which inflammation, antibody production, and complement-fixing immune complex dispositions result in tissue damage. As a result, let me inform you about the dangerous factors behind being diagnosed. Essentially, lupus creates antibodies which are attacked by healthy cells within the human body. This makes lupus extremely hard to diagnose, as sometimes doctors will account for symptoms through a much simpler diagnosis such as bacterial infection. The common mixed diagnosis of lupus are what makes a disease so dangerous. Left undiagnosed, lupus can ravage the body and attack important organs such as the liver, resulting in life-threatening situations for the patient. Let me now show you symptoms behind lupus. There are many symptoms of lupus, and every case is different. The most common symptoms in lupus patients include photosensitivity, the butterfly rashes which appear in the face at times, extreme fatigue, joint pain, and various infections throughout the body, similar to other autoimmune diseases such as Crohn's disease, which has a period of activity known as flares, which can be described at times when patients experience severe symptoms and discomfort. Now let me inform you on solutions to being diagnosed with lupus. Because lupus has so many different symptoms, treatment for lupus can sometimes be extremely challenging. Not only is it difficult to treat all the symptoms, the treatments themselves can sometimes have unwanted side effects. The most common types of treatments for patients include NSAIDs, such as ibuprofen, steroids, and hydroxychloroquine. An anti-malaria drug, usually a combination of these treatments, are used to combat the symptoms of lupus. Author Tiago Marquez and Davi Orgueiro state in the journal Lupus Symptoms, Treatments, and Potential Complications, published by Nova Science in 2012, that due to earlier diagnosis and better treatment options of both diseases and complications, prognosis has markedly improved in the last decade. The 5-year survival of patients with SLE has exceeded 90% in most centers. However, morbidity, especially renal failure, and mortality from cardiovascular events after long-term follow-ups are still an important issue. So when it comes to meeting a lupus patient, be more reasonable when trying to understand what they have and what they are going through, which is not explainable in just one simple conversation. We all want to stay alive in this life and strive for greatness as long as possible. But lupus can affect you in many different ways and ultimately change your life and your future and what they have in store for you. I wrote this speech for my friend with lupus named Hannah, and my name is Dylan. Thank you very much.